One of the big reasons that we are doing these sessions is we wanted to get information out to the childcare community so that you are aware of what's happening, provide updates, but we also, more importantly, want to hear from you and hear what your concerns are and some of the issues that you're struggling with, and see if we can find some solutions that will help. Tonight's evening will be split. The first half will be presentations by Earl Stoddard, who is, excuse me one second. Sorry about that. Director of Emergency Management and Homeland Security. Dr. Travis Gales was to participate this evening. Unfortunately, he got called away to another matter. So we do have Cindy Edwards, who's a senior nurse administrator with Montgomery County's Department of Health and Human Services, who will fill in for Dr. Gales. And then the rest of you will be joining us as well. Tonight will be broken, as I said, into 2 parts. The first part will be presentations on 3 topics. The 3 big topics related to COVID. This evening really is all about COVID. We're going to talk about testing. We're going to be talking about the rationale and how childcare programs are closed, and then vaccines. And I know everyone is very, very interested in hearing more about vaccines. And then the second part of the evening, we will open up to question and answer. And that's when we will unmute you, and we're going to, you're going to have 2 different forums. You can either write your name in the chat and I can call on you, or you can write your question in the chat if you feel more comfortable doing that, and I will read the question out to the presenters. So I want to get straight to this because we only have an hour and I respect everyone's time. So I'd like to start with Cindy and Earl. I'm not sure who's going to talk first. The first item was about testing. Who wants to talk a little bit about testing?
I have no issue talking, but Cindy, you used to be my boss, and you know a lot about this more than I do in some cases. So if you want to start, I'm happy to follow, but I'll go if you don't want to.
Is Cindy unmuted? Hold on. There we
go.
You
can unmute right now.
Okay. Cindy, you should be able to unmute. I'm not sure what happened. Can you unmute her, please?
I sent her the request.
So Cindy, if you click unmute.
There.
I love technology. Hold on.
Okay, a sec.
I don't know what happened. Earl, do you want to start a little bit and talk a little bit about testing? Some of the information about where they're located and perhaps also costs and timing that's involved with testing.
Sure. So good evening. Thank you for having me. Thank you all for coming and obviously hearing what we have to share. So on the testing front, the Department of Human Services has considerably ramped up testing in the recent months to account for the number of people who are seeking testing. We've seen a significant spike in testing requests and people seeking testing since the holidays. Last week, I believe there were a little more than 12,000 individuals who received testing through the Montgomery County Department of Health and Human Services apparatus. And obviously that does not include private providers and others who have testing availability. At this point, the county is operating multiple testing sites just about every day. So people can either there's a list of on our COVID-19 website, you'll actually find a lot of information you'll hear about tonight, but it does have a testing schedule. We also send that out as a press release every Friday announcing the following week's test results. And so we usually have between, 10 to 15 sites per week that are offered through various opportunities. Those sites cost, there's no fee charged through those testing sites that the county runs. You can come in, get tested. They are typically a self-collection, meaning that they are not the back of the nose swabs that have previously been described, but they are more the imperial nasal swabs, meaning that's from the nose. and they therefore are not as invasive as the other previous some of the tests that have been done before. The test results typically right now are it's usually between a 3 and 4 day turnaround, and that is pretty consistent. We've actually seen there was a huge turnaround delay after the Thanksgiving holiday. We saw a slight uptick, but not nearly as pronounced after the Christmas and New Year's holidays, and we've actually seen more normalization over the last couple weeks in testing results. You are permitted to come in really as often as you feel like you need to be tested. I would say that most people who are working, in a field where, like childcare, where you're getting exposed to a number of children and parents on a fairly regular basis, probably every other week, or maybe even every week if you have a larger facility with a lot of potential interactions. Obviously, about between 40 and 50% of cases of COVID-19 right now are asymptomatic, and there's some real conversation around how much really asymptomatic spread contributes to COVID-19 transmission. But the reality is that it is a non-zero number, meaning that there are people who are being exposed by those who are asymptomatic. It's just a question of how many, how much that happens. Now, I see a few of the questions. I'll try and answer them as I go along. So the nasal swabs are just as accurate. All the tests the Montgomery County Health and Human Services utilizes are between basically around 95% specific and 95% sensitive, meaning that they will 95% of the time they will give you the right answer, meaning they won't give you a false negative nor a false positive. That is true for the nasal collection swabs that are done with the swab. Is at the spit test that we've utilized and do utilize in some of our clinics. The same is true of the deep nasal swab that you get. In terms of asymptomatic carriers of COVID-19, I would say that it is more common to see asymptomatic carriers in children. Generally speaking, that is one of the reasons why actually the incidence of COVID, children for whatever reason do not appear to be as readily infectable and or are capable of transmitting. They do transmit and they are infected, just not quite to the degree that adults seem to be. The exact numbers relative to one another is something that is really questions, and we get this kind of as it relates to our schools all the time. Children lag community transmission. I believe 0 to 9 is approximately 5% of our cases, and 10 to 19 is approximately, I believe, 8 or 9% of our cases. That most recent data, and so obviously that is disproportionately lower than adults in the 20s, 30s, and above. So they're some of the smaller categories of people who are infected in our total overall number of cases. So.
So can I ask a question real quick?
Of course.
In terms of testing for young children, there is some confusion in the childcare community. Children can be tested, correct?
Yes.
Okay.
Yes.
All right. So because there was a question whether or not children under 5 should be tested, even if they have no symptoms.
Yeah. So I think that yes, they can be tested, and what I would say to whether they should be tested is testing is good in just about any circumstance. The frequency of testing should be really related to. The frequency of testing should really be related to the amount of exposure. So one of the reasons, particularly early on in the pandemic, that we saw very few children being infected is because very few children were being exposed. I mean, schools were limited and other activities were limited. People were keeping children at home a great deal. And so we saw less people coming out to be tested because, frankly, many people viewed bringing people out to get tested as a potential opportunity. We haven't seen, transmission in testing, and there's no real risk. There's no risk of getting COVID from the test itself. It's just a matter of people were sheltering children to a much higher extent earlier in the pandemic, and we've seen that more normalize as more activities involving children have opened, whether it be youth sports over the summer and other things. But children absolutely can be tested and should be tested based on the frequency of their risk of exposure.
And also a question about the what's called the rapid test and the PCR test. The county is not doing the rapid test, correct?
So we're in the process of getting approved for the rapid test. So we have the equipment to do the rapid test. We are required to get a certification from the state, which they have taken a little longer to get to us. Once that happens, the county will be utilizing the rapid test in some of our more challenging situations, particularly in our homeless shelters, for example. It is not generally utilized around the county because it requires specialized equipment to read the rapid test, and rapid testing has not been as readily available, nor has it been as cost effective as we had hoped it would be at this point. So most testing in the county that the county does is not rapid. There are some private sector rapid testing options that are available for people who need it, but that typically comes with a cost.
Okay. All right. And then there's a little bit of background noise there. I'm not sure if someone has their mute off. Kenya, can you see what that is?
Yes, give me 1 second.
Okay.
I'm just gonna lock the unmute for everybody.
And then we'll unmute ourselves. Yeah.
Yes.
Okay, there we go. Okay, so another question we had, Dr. Stoddard, was in terms of the testings themselves, the swabs that go through the nose are just as accurate as other ones, correct?
Yes, the nasal swabs and the spit tests are within the same range. Any individual test can have a little bit of variance, and when I mean a little bit, like 1 or 2% up and down.
Okay.
But all the tests that we utilize in the county are quite effective. And Cindy's texting me, so I'll be able to see if she can chime in if she wants. She can't hear anything, so that's a separate issue.
That's a separate issue, yes. Kenya will work behind the scenes with her.
Yes.
Okay, some other questions that we had that came in through our survey when we were looking at what topic to do this evening was the tests currently are free, correct? And how
Correct.
long will they be free?
So you can be tested as frequently as you want. There will be no cost to you. The county covers the cost of county-sponsored testing locations. That will be the case. We have no plans to change that at any point during this pandemic response. Now, in 3 years, COVID might still be kind of with us as an endemic disease, at which point the county will probably not be operating its own testing sites, but the next 6 months, year, whatever it takes to respond to COVID-19, we won't be charging a fee.
All righty. And another question that had popped up was, when and how often should a person be tested?
Yeah, so it varies depending on the frequency with which you interact with people outside your household. And so I think I tried to get a little bit to this. So if you're interacting frequently with different people outside your household, I would encourage you to be tested at least probably every other week, if not weekly. It really depends. If you have a lot, I mean, I would say, like, give an example, like someone who works in a grocery store, for example, where they're having constantly new people coming to the grocery store every day, different people, they should certainly be tested on maybe even a weekly basis. But if you have a closed set of people, but it's still not your household, then every other week would probably be appropriate.
Okay. And another popular question also was, in terms of the testing, does the county recommend, or do they recommend or highly recommend, or can a business require their employees to test frequently?
So the require, I don't know. That's a legal question. I believe that they can, but I'm not a lawyer, so I don't want to say that without giving the wrong answer. We could probably get an answer for that and share it with the group.
Okay.
They can certainly employers can certainly recommend testing, and many do. And frankly, it's probably a good thing that they do. Testing is, regardless of sort of any of the conversation that we have around the vaccine, testing certainly is, knowing your status is important for protecting your family, those you work with. And so it's just an important thing for us to do to make sure that we're not, like I said, if you're going out and interacting in the public space, right now, COVID-19 is endemic throughout Montgomery County. There is not a place in Montgomery County where you could go in terms of, where you couldn't be potentially exposed. If you're interacting with other people, particularly if you're indoors, particularly if you are interacting with different people for extended periods of time, you could be exposed to COVID-19. That's not to scare people. It's just to make people understand that we have to continue to do what we need to do to stay safe, and testing is a part of that.
Okay, thank you. And do you recall the website path for where the testing can be found on the county's website? And that's Montgomery County MD.gov.
/ COVID-19, one word, COVID 19 / I think if you go to that main page, I would just encourage you to visit that page. There's a lot of information. We're going to talk about vaccine in a minute. Vaccine, testing, COVID-19 basics are all on that website. You'll see a tab right at the top that says testing. You click on that, it'll give you the schedule for the next week, where testing sites are at. We are really focused on getting those out throughout the county. We are offering them really highly in the areas that have been really disproportionately impacted, and particularly in the Wheaton Silver Spring area have been really impacted by COVID-19 more than many other places in the county. And so we try and concentrate options for testing. Similarly, we'll do that for vaccines for areas that have been disproportionately impacted.
Okay, and again, they are free at this time. I do know that they ask for insurance information. If you go to other places, the county also asks for the insurance information.
We don't right now. So what typically we have done in the past is we have asked for insurance information. So if you had insurance would cover it. If you didn't have insurance, we covered it. It was just basically a way to extend our resources farther. I don't actually think right now we're actually asking about insurance information, because it's not, we switched vendors late in the summer and have not picked that option. So if you are asked for insurance information, it's simply, if your insurance will cover it, they'll cover it. If they won't, we cover it. There's no out-of-pocket costs. So
speaking from a personal experience, I have college kids who need to go back to college with negative tests. Very quick and easy to go through the county, and got results within 3 days. So it was painless, at least from the mom's point of view. All right, thank you, Dr. Stoddard. Is Cindy back on, Kenya? Because I'd like to transition to decisions for closing childcare programs.
Yes.
To assess just how much spread has potentially occurred in the location. They'll work through and make sure that the procedures in place are solid enough where they believe that either they can continue or they can't. It really depends on how many cases, what the nature of the facility is, the nature of the context. And so there's an individual decision that is made around each facility. The county's perspective is, if we can keep something open and operating, we're going to prefer to keep it open and operating. And so what that may mean is, in a childcare setting, if you're a slightly larger childcare provider, it may be a single room that is closed for a period of time, because obviously when there's an exposure, they may want to do a quarantine of those who were exposed to prevent, should they develop symptoms, you don't want them to be exposed in the rest of the facility. But it'll be an individualized decision that's made in concert with the health department, essentially, on what exactly and how long something will need to be closed or not closed. If there are good cleaning procedures, if there are good practices in place, the disruption will be hopefully minimized. But again, it just depends on how broad the exposure may have been in the facility and how many people are at risk, and whether, frankly, there's some operational decisions are in there. Like, are there enough operators to maintain the appropriate ratios if some people have to be quarantined for a period of time? So that's sort of how the decision process goes. There will be a conversation with the facility in the cases where there is this issue. And so it won't be like from on high, there's this order to close that comes down. It will be a back and forth conversation with them about how many cases there's been, what data they have, what the processes are, what the procedures in place are. And so that's generally how that will work.
Okay. Cindy, I believe you should have received a permission to unmute. If you click the...
I just did, yes.
Okay. Yay. All right. Cindy. All right. Can you talk a little bit more about closures and some of the... I know that we have a dedicated group of nurses that are taking the calls for schools and childcare, correct? We have a team?
Yes, yes, you do. And you still have that team. That team is still responding to child care cases or cases that are occurring in child care centers and homes. So
Okay.
yes, they're very, very responsive and busy.
So I think Dr. Stoddard, you hit the nail there when he was saying that, there are multiple factors that are taken into consideration when deciding what are the next steps for a child care program, whether to remain open, partially closed, or fully closed. Can you speak a little bit more in detail about that?
Me
Sorry, Cindy, yes.
Sure. So, there is a lot to consider when you're looking at closing and quarantining. And some of the things are related to what kind of a facility you're in. So it's hard to close. It's hard to leave partial open if it's in a home. It also, if you look at a facility, even a larger setting, do you have separate doors for different groups? Do they share time in a big room? Are the babies only with the babies? Are the 3-year-olds only with the 3-year-olds? And so you've got smaller space with where you have cohorted kids. When they're all running all over the place, it's really hard to say, well, we're just going to shut down the baby room when the kids are everywhere. The baby room is probably not the best example because they're probably in cribs and they probably are the least exposed because, it's a small group and just a few staff. But the kids that are more ambulatory, unless you make a point of separating them so that you have cohorts of kids, you may have to shut down the whole facility. And we look at everything when there's a case. We look at everything there. We look at the facility, we look at the staff, we look at where they might be together, like at lunch or outside. We look at what things have been put in place to keep kids kind of away from each other. Are they wearing masks? Are they, washing their hands? Do they have plenty of opportunity to, to spread out? And all of that goes into our recommendation for closure or partial closure or whatever the case may be.
Okay, great. And then when a program is going to be closed completely, what types of instructions are they given about reopening? Again, is that individual? I don't think there's really necessarily a cookie cutter response to that, but what are some of the indications that the program will receive in terms of reopening again?
So I think some of it is, you've got that 14-day quarantine period, and that's pretty standard, unless there's some unusual circumstances which might allow you to open earlier or perhaps have to stay closed longer. One of the issues, especially in some of the child in the homes, is that it's not the children that have COVID, but the adult maybe. Mm-hmm. And then the adult is keeping, they have to wait until the adult is symptom-free after 14 days. And so that also gets factored into what happens. Again, it is case by case. It may seem a little arbitrary, but it really isn't. We try to close as quarantine only the part of the program that requires the quarantine recommendations, and we try to keep the rest of the place open if we possibly can.
So one of the things that the R&R has been trying to promote as much as possible on social media is really, as educators, you are the experts to communicate to the families about signs and symptoms and what are, physical distancing, washing hands, and cohorting in childcare. But, if a child were to arrive to the program with a positive test and still attend childcare and there's exposure, it's important to call our public health department. So Cindy, do you have that phone number handy?
Yeah, I think what they're doing right now is they're calling our intake line, which is
Correct.
240-777-1755. And then the, whatever the issue may be, then gets routed to the nurses that are following schools and childcare.
Can you repeat that number
And
one more time?
Yes, sure. 240-777-1755.
Great. Okay. All right. And then another question that was very popular in our survey was, does the county publish the number of full or partial childcare closures in Montgomery County?
I don't believe they do, but I do know that the state, we have to report all the cases to the state's childcare consortium or whatever it's.
Maryland State Department of Ed, Office of Child Care, yeah.
Yes, so we report individual cases to that location. We report outbreaks to another I'm having a blank. Another program, Maryland Department of Health, and that's for outbreaks.
Mm-hmm. Okay.
And so, we have two, like we are dealing with what child care is saying we need to do. We're also looking at what the disease control at the state is saying, and they are the ones that determine if we have an outbreak. Now, I don't think they publish outbreaks, so outbreaks would be 2 or more.
Okay.
And I don't know if that's published anywhere, but I know that they give, if there's an outbreak, every outbreak gets a number.
Okay.
And we have used a lot of numbers, not just on child care, but we have had, as you would imagine, a lot of.
So
outbreaks.
Really it's the state that's documenting that.
Yes. Yeah.
Okay. So now I want to switch into vaccines. So when I lost
that's my favorite part.
it is the hot topic. Everyone is very excited. The governor did issue his state was that, things have happened in the first 11 days of the month. I think it was last week that he said that childcare would be in phase 1B. So I'm not sure, Dr. Stoddard or Cindy, who wants to speak to vaccines in terms of, there's questions about, is it safe, but also in terms of what system are we going to use to really target and outreach to our child care providers and educators to ensure that they have access to the vaccine.
So my guess is, sorry, Earl, if I start, my guess is that we will be reaching out to the Child Care Consortium in Montgomery County and letting them know that we are now in 1B and that child care providers as well as teachers will be able to get vaccines. And when that notice goes out, you'll be directed to go to the county's website and put COVID vaccine, montgomerycountymd.gov/COVID vaccine, and you'll see the opportunity to sign up to get the vaccine. And you have to put in you have to do the registration online, and partly because that makes the process when you actually get to the location to be vaccinated, it makes the process a lot quicker at that location. So you would sign up to get a shot. Right now we are running 2 locations, but I expect that will increase and we'll have more locations soon. But they sign up, you pick a time, you fill out the forms, and then when you go, you may have a little bit of a line, but there's no cost, and you will have already been screened. You get screened again when you go in, and then you get your shot. It is a vaccine that you have to have 2, and they're 28 days apart. It's the Moderna vaccine, and then you'll get a notice. You'll get a reminder that you need to come back again for your second vaccine, and that will come to you automatically in an email, and then you will make that appointment as well.
Okay. Dr. Stoddard?
Now,
I think a little bit.
I will
Yeah.
say that,
Go ahead.
you know, eventually I think there will be vaccine at the private doctors as well, but the state hasn't pushed that out yet. They're kind of waiting for us to get done with 1A, 1B. I mean, the first tier and the second tier and the third tier, and then they'll probably start pushing it out to the providers.
Okay.
But for right now, you might have to stand in line, but you can get it once they open it up to the child care providers.
Great. Dr. Stoddard?
Yeah, just a few additional details. So right now, we're currently in phase 1A. We're doing tiers 1 and tier 2. We are likely going to be adding at least some elements of tier 3 this week, most likely our public safety agencies, and going into tier 3 of phase 1A probably next week and likely through about the end of the month. I would expect we're in tier 1B, or sorry, in priority group 1B beginning in approximately February. That's my best assessment of how long it's going to take. And then obviously within priority group 1B, the first tier is adults 75 and older. The second tier includes childcare workers, so right thereafter. So, you know, mid to late February is probably the earliest we're talking about. But again, this is wholly dependent on how quickly the state gives us vaccine with which to distribute. For context, we have had tomorrow will be our 4th distribution of vaccine. We've gone 100 doses, 4,200 doses, 8,600 doses, and then back down to 6,700 doses. And so neither of those numbers are that large. So obviously getting through tier 1A has been slow going. There are also distribution efforts that are ongoing through the hospital system and in the through a federal contract, the nursing homes and assisted living facilities. So the county is not the only people vaccinating right now, but we are the only ones able to address the private care providers and others. So what, as Cindy described, it'll be a process that's fairly similar to what's being done with healthcare providers now. There'll be a survey that'll be made very public. As a child care provider, you will be able to fill out the survey, and what it will essentially ask you is how many people are in your child care practice, how many workers are in your child care practice, and you know we're going to match it up to licensure and basically go along the same way that you know we have had a lot of instances already of, particularly in the healthcare setting, hospital links for hospital employees being shared broadly and people trying to use those to register. There will be an effort to try and ensure that the people who are getting the vaccine are who they say they are, both in terms of the registration process, but also when you arrive, we're going to be matching up, you know, are you a childcare provider affiliated with a licensed childcare provider? And, you know, obviously that's an imperfect process and our goal is to get the vaccine out, but there will be efforts to ensure. So anything you can do with your staff to try and connect with your licensure through the state would be helpful to you at this point.
So I do have a question about to interject here. You know, in centers, there are employees, but in a family childcare, there's other family members. So is there consideration how the county is going to put out the call for vaccine when it comes to family childcare providers? Because the adult there is not only the provider, but also anyone else who lives in the home.
Yeah, so Cindy, if you've gotten this level of detail and planning, I will be impressed. But I think that,
you know, I feel like, well, first of all, remember, the Moderna vaccine, which is what we have, is only down to 18. So we're not going to be vaccinating anybody's kids.
Correct. But we have many, we have family childcare homes where there could be several adults living there as well. So I think it's a consideration as the county's planning to think about how we're going to resolve that.
But just to give you context, for like older adults, 75 and older, we're vaccinating the older adult, not everyone who may live in that household with that older adult, just so we're clear. So I think I think it's very, okay. I don't want to have a definitive answer here because I think this is something the team will discuss. And Cindy, correct me if I'm wrong, but I think this is something we'd want to discuss, and it would likely be focused towards the actual childcare provider.
Correct.
Right.
Okay. And then
Right.
for childcare programs that have substitutes or staff that have been on sabbatical, regardless of them being out, they would still fall under childcare if they're returning to work to be able to get the vaccine, correct?
Yes.
Okay.
Right.
Right.
But remember, they might have to wait. There might be a line.
Yeah. Yes, I'm
Yeah,
sure.
I mean-
And I think we need to be respectful so that this is an evolving process too, where
Yeah,
As we-
and I think the big thing is to recognize is that in the state of Maryland, the estimates from the state are that in phase 1B, which is where childcare providers fall, there are approximately 892,000 people. That is approximately 15% of, I'm trying to think of like doing the rough math. It's a significant percentage of the Maryland. We have 6 million people in Maryland. It's a significant portion of the state population that covers. We will not get enough doses on day one of tier 2 to vaccinate every childcare worker in the state. In addition to the fact that there are 24,000 MCPS employees, the school system, we're going to try and be equitable in how we do this and hit the people who are at the highest risk. And obviously, childcare providers are providing childcare already in settings, so that will be part of our equation. But just understand that it will be a weeks long, if not months long, process to get through phase 1B.
Okay, so I'm going to go ahead and open up now to our many people, 70 people who are on to ask questions. You are able to unmute yourselves, audience, so that you can ask your questions. So I will, hold on, I think Kenya, is that correct? They can unmute themselves?
Yes, they can.
Okay, awesome. All right, so we will open up questions. And I do want to, again, we had some technical difficulties, so we'll go 10 minutes over for that time that we missed. So I'm calculating about 20 minutes now for questions. Let's keep it on the 3 topics, which are vaccines, testing, and closure. So I'll open it up now. Who would like to ask a question?
Does it have any side effects?
The vaccine, does it have any side effects?
So the individuals that have been vaccinated already, I think the most common complaint is that their arm is a little sore, and it's tender. I did not have any real problem except that it was just a little sore, kind of like if you recall getting your tetanus shot, kind of like that.
Okay.
But again, having said that, there can be a severe reaction to the vaccine, just like it can for any vaccine. And if you've ever had any problems taking vaccines, then I would certainly consult with your private provider before I would stand in line at one of our clinics and get the vaccine at the clinic. We have providers there. We have doctors there too. We have, the emergency care that we may need to use as well, but you can have some mild reaction to the vaccine also.
Okay, thank you.
And someone in chat did raise a good point. So the second dose of the vaccine, we've had very few second doses from, I think we've in the hospital setting, we've had several second doses. We've had very few from our health and human services, but there are reports nationally of the second dose being slightly worse than the first dose. But as the person in chat correctly noted, it is substantially less bad than COVID. So
good point.
so the rate of anaphylaxis, which is like a reaction to the vaccine, is approximately 1/100,000 right now, which is not. It's a non-zero number, but even those who have any sort of reaction, and again, it's 1 in 100,000, is treated with an EpiPen and recovers quickly. There's been no vaccine-related fatalities across the entire country, in the entire world. There are none that I'm aware of. It is, as Cindy alluded to, and she's gotten it, so she can speak firsthand. Some soreness, maybe a little fatigue, maybe a little bit more fatigue for the second dose. But a heck of a lot better than COVID.
Great. Good point. Thank you. Another question from our audience?
Hi, I have a question. If
Sure.
we are in a preschool / childcare in a religious institution,
and the rabbi, the clergy meets with the kids. But they're not necessarily on our database of preschool teachers. Are they allowed to be on our list for vaccines because they do see the kids?
I think that kind of depends on the, they're not really with the kids all day long. They may, and how close are they sitting? They should be, let me remind you, 6 feet.
Yes, if they're doing if they're doing a Friday service, and yes, they are far enough more than 6 feet away, but I'm just curious, we chose to do this because we have to be far away, but if we have the opportunity to now have them a little bit closer would be great. But yes, it's 1 day a week. So I just was curious if they are considered part of the program or no.
So probably not right now, unless their age is over 75.
Okay.
That there's also that. But
fair enough.
Even with vaccines, people will still be wearing masks, and we still will be doing social distance.
Can I put a point of clarification that the vaccines are recommended, they are not required, correct?
Yes, that is right.
Highly recommended.
Yeah. So there have been some the EOC or the EEOC, which is the Federal Committee on Equality in the Workplace, essentially has suggested that it may be permissible for employers to require the vaccine. The stance of the county has largely been that we will not be requiring the vaccine while it's under an emergency use authorization, meaning while it has not gone, we have no concerns about the safety of the vaccine, but until it goes through the entire FDA approval process that every other drug goes under, we are not going to require it for our staff, and would similarly recommend that people follow that guideline, that guidance as well.
Great. Another question from our audience. You can unmute yourself.
Hi, this is Lynette. I have a question.
Hi, Lynette.
Hi, I'm one of the family child care providers that you were speaking of, and I have an additional adult she's not working right now with me, but she works with me. So if I can understand this clearly, as long as she's on the OCC license, she can also get it. But none of my parents that come here and the children, my clients, can't get it.
Correct.
Okay. Thank you.
Okay, thank you. All right, and anyone else would like to ask a question? Yes,
I have one. So I have a staff member that lives in Virginia, works here in our center in Maryland. So I don't know which state she should try to get vaccinated, or try to sign up for both, or what? Yeah.
Either or both.
Whichever one is faster.
Yeah, either or both. We're not requiring a demonstration of residency as it relates to. There's still an open question around the state of whether for the open categories like age categories, or when we get to the general public, there will be any requirements for residency, because candidly, there are some jurisdictions in the state of Maryland that have so few people in 1A that they're getting close to 1B, and they want to restrict 75 and older to their counties because they don't want people driving from Montgomery County to Garrett County, for example. But as it relates to, even in 1A, we've got healthcare workers that do not live in Montgomery County, that do not live in the state of Maryland, who are coming to work in our hospitals, and they are being vaccinated through their employer. The same would be true of our child care providers.
Thank you. That's helpful.
Who else has a question?
I know you were talking about requirements for the vaccine. What if one of your teachers is pregnant and they can't get the vaccine? Well,
you can get the vaccine if you're pregnant. Yes.
Everything I read said no. Okay.
No, it is okay to give to pregnant women. You know, we don't even require that you get a note from your doctor that says you can have the vaccine. It is, we can give it to pregnant women. Yes.
And remember that this is not a requirement. It is highly recommended to have the vaccine.
Right.
Was the vaccine tested on pregnant women? Because my employee is nervous about that. I didn't think it was tested on pregnant.
Yeah, there were some, I mean, yeah, there were definitely some pregnant women in the trials. Now, I don't know how many that was, but you know, I'll put a link in the chat. There is CDC has some recommendations around pregnancy for women in the COVID-19 vaccine, and it is one of the recommended groups, but I'll put the link in the chat for you to share.
All right.
Yes. Hi, Dr. Stoddard. I have a question for you. When you get the vaccine and you get this card or certification, correct? Once you get the card. Okay. So that's in record. You said mostly the state has all that information. So let's say you get the vaccine and then you get COVID again. And is there any information on how many people have gotten it, even taking the vaccine?
It's not a live virus, so you're not going to get it from the vaccine.
So it's not 100%, but it's close enough.
Yes. Yeah. So even in the clinical trial, there were people who got the actual vaccine who ended up getting COVID, but the incidence of COVID in those who got the vaccine was minute relative to the incidence of COVID in people who did not get the vaccine. So it is 95% effective, not 100% effective. Right. And some of that may have to do with the timing. And so, for example, when you receive your first dose of COVID-19 vaccine, within approximately 10 days, you get between, depending on which vaccine you get, between 50 and 60% protection. When you receive the second dose, 7 to 10 days after that is when you get the maximum level of protection. So some of the COVID-19 vaccine ineffectiveness may be a timing question and just when people got exposed relative to when they got the vaccine. But right now, I think with 2 doses, it is the recommendation from the data out of FDA is 95% effective.
Great, thank you.
And you know, it's similar to getting flu shots. You know, people get their flu shot in the fall because that's what you're supposed to do, but they may have already been exposed to somebody and they may already have virus circulating, and then they get sick because they were actually getting sick before they got the flu shot, and then they think it was the flu shot that gave them the flu. It really is timing, and you really, you know, it's hard to say, oh, I got it because I took that shot. It was probably because you already had some circulating virus in your body and you were going to get sick anyway. Which is why we say, you know, get your flu shot early and when it's not quite as prevalent.
Okay. Anyone else have a question that you'd like to ask either Dr. Stoddard or Cindy Edwards?
I do.
Great.
Upon registering on the Montgomery County website for receiving the vaccine, does that automatically connect us with the state's personnel list that we hand into the OCC, or do we need to bring in a valid ID or a pay stub indicating that we're associated with a licensed child care center?
So I don't think there's that connection.
Can you say that? Can you say that again?
Dr. Stoddard?
I don't think that the data for the COVID vaccine goes into the system Immunet, which is where all the vaccine, you know, that's where all the vaccines that are given are kept and stored. I don't know that actually talks to your system.
No, the way this will likely work, and just to be clear, this is still being finalized and worked out, and so some of these details we're sort of working through in real time. I mean, this is challenging for everybody. There will be a survey that goes out, and what that survey will essentially ask is some basic questions around, you know, are you a licensed child care provider? Are you, you know, how many people how many people are employed inside in your center? Questions like that, and then you'll submit that, and based on that, it'll go into essentially a listing for Health and Human Services. What they'll then do is based on, you know, they'll verify that, yes, this is actually a childcare provider with a license in the state of Maryland, and then they'll send a registration link to you for your practice, your facility. If you're an individual and you're licensed as an individual, that's fine. You'll get the individual link, and you'll utilize that link to essentially put in your information related to getting the vaccine, give your consent, select your location for where you're going to get the vaccine and the timing of your appointment and all those things. And so it'll be really a two-step process. The first step is filling out the survey once it's released, and that will allow them to collect the information that verifies that you are a child care provider. And then when you get the registration link, you come to the location, and then they're going to have your name on a list, and you're going to check your name versus what's on the list. And so, like I said, we've had people trying to share it. We've had physicians share it with their parents, and they're unfortunately showing up these vaccine sites, not being able to demonstrate that they're an actual healthcare provider, and they're being turned away. And so it really is making sure that you can align with what you submit through that initial inquiry with who is affiliated with your facility. And so that's going to be an important linkage.
So I think it's important to also note that when you get that information, you know, the R&R and HHS, we will do our due diligence about making sure that that information is blasted out to the childcare community so that you are aware. I'm also pretty sure that your licensing specialist will make sure that you get that information so you know to expect it, as well as who to expect it from, so you don't think it's spam or something like that.
Okay, so once we get the link, can the link then be shared with our staff? Or does each staff receive an email?
You'll share the registration link with those. It won't be an individualized person by person link. It'll be a link to your organization. And then, you know, when you show up, they'll just have to show identification.
Perfect. All right, thank you.
I have a question, doctor. So I have one of the employees who works with us for childcare, and her husband works at 7-Eleven. So do we require her to do testing every week?
Should the employee be tested every week? Is that your question?
Yeah.
Because the husband works at 7-Eleven.
Yes, her husband.
Okay.
Yeah.
Cindy, I don't know if you have an opinion on this. I would say, I mean, requiring someone to be tested is a pretty onerous thing. I would say, right, recommending that they get tested fairly frequently is important. You know, every other week because it's not the same, you know, the person per se, would probably be okay. But as frequently as they reasonably can, we would recommend to be tested.
Okay.
And you know that you can get tested at our county testing points of distribution, and you can find those also on the county's website. And they are at this time and have been free. So you may have to wait a little bit, but the testing is free. And the results are usually back between 2 to 5 days. So it's a pretty good turnaround considering.
Okay, thank you.
Sorry. Okay, I'm going to take one more question. And then just as an FYI, the questions we could not get to that were written in the chat, I'll consolidate them and try to get some answers to that as well. So when we post the two-part webinar for this evening, I'll try and get those answers there as well. So one more question. Who would like to be the last one? No?
I'll answer that last question because I think it is important. So if you're doing routine testing, if you have no reason to know that you've been exposed, and you're just doing routine testing, Montgomery, like we've got employee testing that's ongoing. So if it's just a routine test that you're doing every other week, every third week, whatever you're doing it, you have no reason to believe you've been specifically exposed, you can continue to work while you're waiting test results. However, if you travel, if you have a specific instance where you believe you may have been exposed and you're getting tested for that reason, you should absolutely be quarantining for the period while you wait for the test result to come back. And so, you know, I get tested regularly through our office. I don't quarantine necessarily while I'm waiting those results because I don't have a specific case or instance where may have been exposed. If I were to travel, if I were to do anything where I believe I put myself at specific risk to be exposed and I'm getting tested as a result of that, you should be quarantining. In fact, state law or the state order requires that if you travel or do anything like that, you quarantine while waiting the results.
Okay, so again, I want to thank both Dr. Stoddard and Cindy Edwards for being available this evening to answer these questions. I'm hoping that, you know, I'm sorry about the little break there due to our technical difficulties, but I do appreciate everyone's time this evening. There's, I know this is an ongoing discussion, and so we would like to hear from you. Send us an email at earlychildhoodservices@montgomerycountymd.gov with any questions you have. As a reminder, we also have Star Stevenson, our child care health consultant, who's available to provide support to and answer questions to child care programs, both family and center-based, on anything health and safety related. As you can imagine, she's been very busy with COVID-related questions. And we also have staff available who can help you with some of the more ins and outs that go on with like cohorting and physical distancing with preschoolers and toddlers. So again, thank you everyone for this evening. And we will be, as I said, posting this sometime tomorrow and trying to answer some of the questions that we didn't get to. So I hope everyone has a good evening. We'll be doing this again next month. Next month's topic is going to be on business and financial supports. So thank you very much.
I have a quick question.
Okay.
Where can we see the recording again?
We're going to be posting it on our YouTube channel as well as our webpage, and I'll send it out in a, everyone who registered tonight will get a link to it directly, but it'll also be pushed out in our social media. So look at us, MCCCRRC on Facebook, Twitter, YouTube. It's all the same handle. All right, everyone. Have a good evening, and thank you. Thank you, Dr. Stoddard. Thank you, Cindy.
You're welcome. Thank you.
Good evening.